Hey everyone, welcome to Eye to Eye. So, how much pain do babies feel? The common thinking was that newborns were not developed enough to feel or remember painful medical procedures. Dr. Sanjay Gupta spoke to a researcher who's treating major pain in his hospital's smallest patients.
So this is Josie.
Yes, this is Josie, and Josie is doing very well now. When Josie was born, Josie was a little bit early, but developed a fairly common complication of prematurity called PIE, which is similar to small, tiny air bubbles in the lungs, kind of like a collapsed lung in microcosm.
Something that happens to premature babies.
Yes, it is.
Yeah.
And the thing is, that particular condition, and I've never had a collapsed lung, but people who have had that tell me that it's extremely painful. And Josie did require a fair amount of pain medication when she was in the initial stages of her illness. And this helped to keep her calm and helped to keep her much more rested. And
how did you know she was in pain?
Well, that's an interesting question. We look at several things when we look for pain in babies. And as a clinician, one of the things that we can look for, we look for two things basically. We look for what we call physiologic parameters, which means heart rate changes, blood pressure changes, changes in the saturation of oxygen. The oxygen levels will oftentimes go way down when babies are in pain. And the other thing we look at are behavioral changes, which means primarily that babies have changes in their facial expressions, and that's actually a very good way to assess pain in a newborn, just like it is in an adult. And we use a pain instrument here called the InPass, and there are several different ways to carefully validate pain in newborns. In fact, there are over 30 different pain instruments that we use that we assess pain in newborn infants.
Why is there such a resistance to treat babies for their pain? I mean, everyone wants to take good care of the babies, I'm sure. Why did the pain things get missed?
Oh, I think that's an excellent question, and people ask that all the time. There's primarily, I think, three reasons. One, the baby cannot say that they're in pain, and so they're not strong enough. For example, if I were to put an endotracheal tube down your throat, you would never allow that if you could possibly prevent it. Whereas in these babies, we can physically control these babies without having to use any pain medication, and oftentimes that's the case. The second reason is because there's concern about the pain medication. Many clinicians are worried about some of the side effects of pain medicine, particularly if they're not as comfortable with using these in neonates. And I think the third reason is because babies have there's some concern about whether or not babies can remember that or incorporate that in their cortical processes, which just means can they really think about that and put it in their brain and actually remember it. And I think the answer to all those questions is that, number one, we definitely know that babies can incorporate pain. We've seen that months and years after painful stimuli, we've seen there's lots and lots of evidence that demonstrate that babies do in fact remember pain and are affected by pain. Number two, I think the pain medications that we use in these babies do have side effects, and it's very important that we learn about those side effects. And I think the third thing is there's lots of evidence now from looking at blood flow studies and from looking at behavioral changes that babies do in fact remember and incorporate pain into their brains.